Welcome. I'm Dr. Lauren Stryker, and tonight the topic is itchy vulvas. So we're going to switch gears here because I promised lichen sclerosis. So we're going to talk about lichen sclerosis. I used to say there's nothing to like about lichen sclerosis, and my husband, who's not a gynecologist, would walk around at cocktail parties and say, "Oh, there's nothing to like about lichen sclerosis." But the truth is, what there is to like about lichen sclerosis is that experts like you are really, really good at treating it. And I think, so many women come to the center to see you with their lichen sclerosis, and they just really feel like they're up against a brick wall because it hasn't been treated, and it can be devastating if it's not taken care of appropriately. So for people who are not familiar, can you just tell us real quickly, what is lichen sclerosis?
Yes, so lichen sclerosis is an autoimmune skin disorder, similar to psoriasis, similar to eczema. It's your own body attacking its skin. So this is not infectious. This is not contagious. This is an autoimmune skin disorder. It's common in my clinic, but overall not that common. It affects men and women, but women more.
And not just the vulva. I mean, we see the vulvar stuff, but it can be other places too.
So 90% of the time it's going to be in the genital region, but you can have it in other areas such as the stomach or the arms or the legs. Yeah, it can go anywhere in the body.
All right, so let's talk about symptoms. What are the
most common symptom
sclerosis?
is itching. Terrible, terrible itching, which tells you, scratch me. Your vulva will tell you to please scratch me. And that is probably the most prominent symptom, but that's not it. I have seen many patients who have lichen sclerosis, but their symptoms are not itching. They may have pain with sex. They may have pain with urination. They may have dryness. They may have cuts on their vulva.
Yeah. And we see that so often because, of course, since we run a menopause clinic and sexual medicine clinic, and so often women come in and they have vaginal dryness and pain with intercourse, and they've been told by their doctor, they assume that this is vaginal dryness, so they have been, they're using lubricants, and they've been using, maybe an estrogen product, and all the things that normally would help, and it's not helping. And
yes.
And they've been treated for they might have both things. That's very common too. But I think that's probably the most common misdiagnosis that you see in the vulvar center. Wouldn't you say people who've been, they come in thinking you're going to treat one thing, and then you look and say, no.
This is lichen.
So, right. So can you, and I think it's also important to say sometimes there are no symptoms. I don't know if you mentioned that, but sometimes.
You're right. Sometimes I have caught it on annuals before.
Right. And that's why, don't get me started on that you shouldn't go to a gynecologist, that you shouldn't have a pelvic exam after a certain age unless you're having a problem. Well, sometimes you don't know you're having the problem. And I always say, if your internist is looking at your vulva, then you don't need to come see a gynecologist. But if your internist is not looking at your vulva and is decreed that it's no-fly zone, well, someone's got to look at your vulva, and
somebody
it should be someone who knows what they're looking at.
Yes.
Right. Because sometimes people don't have symptoms, and we're going to talk a little bit about why it's important to diagnose this, I think
it's a misconception that people think I just have to go to the gynecologist for a pap smear. And what they don't realize is the pap smear is only for cervical cancer, which most of the time is HPV mediated, over 90% of the time. So which is a sexually transmitted virus, right? But there's uterine cancer, there's ovarian cancer, there's vulvar conditions, there's vulvar cancer. So who's watching? Right.
Exactly. I mean, I think we're totally on the same bandstand with that one. All right. So how do you diagnose it? Someone comes in and tells how you know that it's lichen sclerosis.
Sure. Most of the time I can look at their vulva and tell it. And sometimes it can be very subtle changes that other people who, and our job is to educate other physicians because, we're so subspecialized. But sometimes it's just so subtle that it's missed. But for example, a lot of times people just go to the vagina to do the exam without looking carefully at the vulva. So when I do a vulvar exam, I'm looking at lymph nodes. I'm looking at the labia majora, the labia minora, so the big lips and little lips. I'm looking at the clitoral hood and seeing if there's any fusion between the clitoral hood and the clitoris. Yeah. And I'm looking at basically the posterior fourchette, which is the opening, just like the floor of the entrance.
One of the things that you just quickly skimmed over, but I think is really important, and not to come down hard on my gynecologic colleagues, but truly when we were trained, it's like every woman knows you put your feet up in the stirrups, and before you know it, the speculum's in and out, and they're doing the bimanual. And in our center, we spend more time on the vulva, probably than anything else for any woman that walks in the door. And the
Yes.
other thing we do that is really important is we use a mirror. We show women what their vulva looks like, because too often women are not looking, and then we can point out what's normal, what's not normal. And for many, many women, this is really the first time that they've looked at their vulvas and that someone has
Right.
explained what's going on with the
Right.
vulva. But describe just, when you said you can tell visually, what does it look like to your naked eye?
So, lichen sclerosus, sometimes the labia minora get absorbed. So they get absorbed into, they fuse with the labia majora. So some people start to lose their little lips. You can often see fissures or little cuts that are, in between where the fusion is happening. You can see the prepuce, which is the hood of the clitoris, fuse over the clitoris to the point where you can't see the clitoris, the hood, the glands of the clitoris anymore. And then sometimes there's shrinkage, there's whitening, and
Yeah.
often it goes around the anus as well in that classic figure of 8 pattern.
Yeah. I think the whitening part is really important, because a lot of people, when they're itching, they expect to, if they do look, they expect to see red.
Right.
And then they see white and they're
Yes.
like, oh, what's this? And lichen sclerosus, of course, can be other colors, particularly if someone's
Yes.
scratching a lot, and they can be like a little bleeding under the skin. Sometimes it's actually even a dark purple.
And bruising, right? Bruising is,
And bruising,
can
exactly,
happen.
exactly.
I've even seen blisters with lichen sclerosus. So it's
That's right.
an
But
unusual
typically when we think
presentation.
of lichen sclerosus, we think of white,
White.
kind of really thin, papery thin looking.
Yes.
It looks thin, but it's thickened. It's
Right.
thickened skin, and sometimes it can even be really thick. So for people who are watching, I know a lot of people here who've said, okay, I had a biopsy to diagnose my lichen sclerosus. So talk a little bit about when you would do a biopsy, because you don't do a biopsy with every patient, do you?
I don't. No. Clinically, if I
You're really
diagnose,
good at this. You see a lot of this.
clinically, if I see lichen sclerosus, then I treat them. If they don't get better, then I biopsy them. The other reason I would biopsy is lichen sclerosus, it has a cancer risk associated with it, up to 5%. So if I have any concern that there is a precancer or a cancer, then I will, without a doubt, biopsy the vulva.
And since you mentioned that, I'm going to bring that up now. About a lot of people say, well, okay, a little itching, I can live with this, no big deal. Or a doctor told me I have lichen sclerosus, and it's not bothering me, or they
Right.
gave me this medicine and they told me to keep using it, but I don't want to. So you mentioned the cancer risk. Can you tell us specifically how common is it when someone is diagnosed with lichen sclerosus, they go on to get vulvar cancer?
Yeah, so up to 5% vulvar cancer. There was actually a big study done in Australia with over 500 women, and the patients who were compliant with their steroid use, so which is the treatment, and we'll talk about that, 0 got cancer or precancer,
Right.
which is amazing.
Yeah.
And very little progression of the disease, and 93% symptom suppression compared to the patients who are not compliant.
Right. I mean, that's huge. I mean, what else, what
Huge.
other condition that we know might lead to cancer that we can say basically 100% of the time, if you treat it appropriately and you do what you're supposed to do, you're not gonna get
It's amazing.
cancer.
Yeah.
Yeah.
And the other number.
But on the flip side, if you look at women who have vulvar cancer, who've been diagnosed with vulvar cancer, how many of those women do they find some lichen sclerosus kind of buried in the vulvar cancer?
Yeah, I'd have to look at that number, but
It's
not.
high.
It is. Most vulvar cancer is HPV mediated, but it's more than 20%.
Yeah, I mean, it's significant.
Yeah.
All right, so let's talk about treatment. Because the people out there are saying, okay, I hear you. I don't want to get cancer. How do I treat it? So how do you treat lichen sclerosus?
So with topical steroids. So that's the only thing we know based on the research that suppresses cancer. Now there are a lot of other treatments out there that they may be recommended to patients, which is fine for symptom control, but for cancer prevention, I use topical steroids. For an aggressive case, I will start with something very strong, the strongest steroid we have in America, which is clobetasol. And then for maintenance, I go to something lower potency, such as triamcinolone, 0.1%.
So for women that are watching that have been given a prescription for clobetasol, I'd like you to get really specific about what you tell your patients in terms of how to apply it, when to apply it, where to apply it.
Yes. So clobetasol is very strong. people worry because it may cause atrophy, it may cause thinning of the tissue. And I tell them, right now your disease is so aggressive that I need to treat it with something strong. This is not going to be your long-term medication. This is going to be just to get you to a point where you're not progressing more rapidly. And what I actually do is I will take some lubricant and actually have them hold the mirror, and I'll show them, we'll pretend like the lubricant is the medication, and I'll show them exactly where to put it. And
Yeah,
it's the whole vulva. You have to make sure that you go above the clitoris,
right.
around, and then also, part of the vaginal entrance goes in a little bit. So I actually show women, you can't just put your finger like this. You actually have to go in and apply it into the entrance of the vagina, and then you have to go down the anus, because
Yeah.
lichen sclerosus affects that too.
And again, this kind of goes back to why we use a mirror, we draw diagrams,
Yes.
because a lot of medications that we use and a lot of things that we use, I'll say, oh, just slather it on, it feels
No.
good. Put it everywhere.
No.
And that is not the case with clobetasol. You have to be very
it's so
specific.
strong.
And it's so strong. And also, I think a lot of people don't realize how little bit, goes a long way. Like I'll say to someone, just use like a little pea size, and that's going to be enough. And they're like, oh no, I've got to, there's a lot of territory in my vulva. How is that possibly going to be enough?
So what I tell them actually is to use their pinky, and the nail on their pinky is how big the blob of medicine should be. So they have it right there.
All right. So what's your suggestion for people that say, I can't see anything? How am I supposed to be able to figure out where to put this?
Sure. Sure. So then I teach them how to use a mirror at home. So there are ways that you can sit, that you can use the mirror. And once you get the hang of it, then you're going to know it's tactile. You know exactly where to put it once you know where you're putting it. And I will have patients who tell me that they can't see. I'll have them demonstrate to me in the clinic with the lube, where are you putting it?
Yeah. I think that's so key, because very often when someone comes in and they're not getting a good result, and we find that they just actually haven't been treating the areas that need to be treated.
Right.
So let's say I'm going to do two scenarios. I want to do the scenario of the person who comes in and you see them for a quick follow-up. That's the other thing too. It's not like, you say goodbye, I'll see you in a year. You're seeing people
every 6
regularly.
months. I see them every 6 months. The first time I see them in 3 months to see the response.
All right, so let's say someone comes back in 3 months, and miracle of miracles, the clobetasol has worked, they're cured, they're happy, everything is great. Now what? What are you going to tell them to do for maintenance?
Triamcinolone. So something not as strong as the clobetasol, and I tell them to use it every day. I tell them, if you prove to me that things have not changed in a couple of years, then we can go down to twice weekly or 3 times weekly treatment. But for now, I want you to use this triamcinolone every day.
And for the person who comes back and they say, okay, it's not working, it's still very symptomatic, you've done your biopsy, we know it's lichen sclerosus, it's not something else. What other tricks do you have up your sleeve to help that person who, because I know that there are people listening that say, I've done the clobetasol thing and it hasn't helped.
If the tissue is so thickened, if the disease is so active that the tissue is, you can't, like, the topical medicine is just not going to penetrate through to treat it. And when that happens, I'll think about systemic treatment, for example, with prednisone, or I'll think about intralesional treatment with injections, steroid injections directly into the tissue.
Yeah. One of the things I want to mention is, I run a laser program, and I use CO2 laser to treat vaginal and vulvar dryness as a result of low estrogen, menopause.
Right.
And we know that it works very well for that. And a lot of women come in and say, I was told that the laser is also going to treat my lichen sclerosus. Will you laser for that? And there finally were a couple of very good studies that were published specifically looking at it. And the bottom line is sorry, but you still have to use your steroids.
Yes.
The CO2 laser can be very, very helpful for women with lichen sclerosus. And that part of the problem is that when you use these high potency steroids, the skin can get very thin, which is a real problem for women who are, dealing with not only lichen sclerosus, but also menopausal dryness. So we very often will treat not only with the steroids, but we'll add in some local vaginal estrogen cream or another estrogen. But that's kind of, from my point of view, where the laser comes into play. Because if I have someone who either chooses not to use estrogen for whatever reason, personal preference, or maybe she was told not to, and is someone who would benefit from laser to help with their dryness and the thinning of the tissue.
Right.
What I have found anecdotally, we don't have good studies, is that it really does help with the lichen sclerosus, just in terms of helping the tissue heal, the
Yes.
cracking and the skin being thin. But it is not going to treat the lichen sclerosus, which is an inflammatory
Right.
process. So I have my patients, and I know we're on board with this because we've talked about it so many times. I have my patients who choose to do laser to do both. They are still
Yes.
going to do their steroids, but it does seem like overall, they
Right.
do better with the laser as a combination.
So the thing is, estrogen hides lichen sclerosus. It can remain hidden. It's genetic. This is a genetic
Yeah.
autoimmune condition, but we see it mostly in postmenopausal women or women or girls, young girls who haven't had their period yet. So,
Yeah, I think we forget that. We always, because we run a menopause clinic, so we see so
right.
many women that are older, but it's in
So
young girls
what
as
do they
well.
have in common? Low estrogen.
Yeah, exactly. Exactly. Um, there was one other thing I was gonna, and I totally lost my train of thought. What I was going to ask you, and if there are any questions, please, keep them coming. Ruth wants to know. I talked about we have this fabulous center in Chicago, and Ruth wants to know, for those not in Chicago, this is challenging. I will tell you, because the truth is there are not a lot of vulvar experts, which I was so excited I was going to go kidnap Dr. Patel, who was actually at the University of Michigan. If you happen to be near Ann Arbor, they have an incredible vulvar program as well. But my recommendation is to go to the nearest large medical center near you, and you've got to really kind of do the little digging and see who treats these conditions. Sometimes it's a dermatologist, sometimes it's a gynecologist,
Mhm.
and quite frankly, sometimes you got to travel. I mean, I hate to say this, but for women who've been suffering, for women that no one is helping them, sometimes you just need to go someplace else to get the help that you need. We do a lot of telehealth. Vulvar conditions do not lend
Yeah.
themselves to telehealth. I'm
So
just saying.
unfortunately, I do have to feel, because a lot of what I do on my exam is feel for pre-cancer, cancer, things like that. So yeah, I
Yeah.
wish I could do telehealth for vulva.
Wouldn't that be nice? We do
That
have a
would.
lot of people that try and send us their crotch shots on their iPhones. What I've learned, is very difficult to take a decent picture yourself. You have to have a really good friend help you with that, or maybe a partner or something. Rebecca, hi, Rebecca. I haven't seen you. I know Rebecca. You did miss this. We just finished the whole discussion on steroids. So we're not going to go back to that, other than to say that, yes, it must be treated with steroids. You'll have to listen to the replay to find out all about steroids. But yes, that is how we treat it. Toshi wants to know, is diabetes a risk factor for getting lichen? We know it's for yeast because you already
For
talked about that. How
yeast.
about for lichen
No,
sclerosus?
no,
No, it is
no.
not. So it's just, common. It's common to have diabetes. It's common to have
Right.
yeast, and then
So diabetes is an autoimmune condition. So type 1 diabetes, I will say that maybe there's an autoimmune link there, but not type 2 as we see it here. Hypothyroidism and lichen sclerosis go together. So if
yeah,
somebody
because it's
has
again
lichen
autoimmune.
sclerosis, yeah,
Autoimmune.
I
Yeah.
will make sure that they have a recent testing for thyroid disorders.
And Jessica wants to know the typical course for the initial use of clobetasol.
So what I typically do for aggressive disease is I have them use it. I have patients use it twice a day for a month, and then every day for 2 more months, and then make the switch to triamcinolone.
And Robin wants to know, treating the dryness from clobetasol, which is a big problem. And
Yes.
she is asking about the use of Aquaphor or another emollient.
This is also a big part of why I switched to triamcinolone. That I don't like clobetasol for a long-term maintenance treatment. Aquaphor is fine. Vaseline is fine. They make vaginal and vulvar moisturizers, and those are fine to use as well.
One of the things I want to switch gears just a little bit, this general topic, is one of the problems that we see all the time is what we kind of call vulvar hygiene. How do women take care of their vulvas? Because the truth of the matter is, if someone doesn't have any problems, if they don't have lichen sclerosis, if they don't, there's so many other conditions that we didn't get to,
Right.
psoriasis and the vulvar yeast, and on and on and on. People that have nothing wrong with their vulvas, quite frankly, it doesn't really matter what they do. They
Right.
could put soap on, they can use toilet paper, it doesn't really matter.
Right.
But for the woman who does have vulvar conditions, one of the first things that we do is to ask them, what products are you using? What could be aggravating the situation, and what should be avoided? So we do have a whole long list of vulvar things, but
Yes.
the most common problems that we see that are causing problems, I'll let you jump in on this first. What are the most
So a
common
lot
things
of
people are
times
using?
this is allergic dermatitis or irritant dermatitis. So something has irritated the vulva. So forget lichen sclerosus. That's much rarer than the contact dermatitis or irritant dermatitis. So I can't tell you how often I see that they've used some sort of product. The one misconception is that, but I've been using this for years. You can absolutely become allergic to something that you've been using for years.
Yeah, I think the other culprit out there that I'm always railing against are these awful vulvar washes that people use
Oh,
because
terrible.
they think that they're horrible, and things like Vagisil and pretty much anything that says put it on your vulva. Don't put it on your vulva.
Another big
We
one
tell
is,
people
yeah,
we tell people just to use water, not even soap.
yeah,
Use soap with it because everyone thinks that. Oh my God, what do you mean don't use soap? I have to use soap, otherwise I'm not going to be clean. So
self-cleaning. The vulva, vagina are self-cleaning. They are.
yeah, and we just tell people use water. And so when women go to the bathroom, either to urinate or have a bowel movement, of course, people want to clean themselves. And toilet paper is not your friend.
No.
Toilet paper, you can pat a little bit with toilet paper, but rubbing all of that is bad. So we tell people use a water bottle, spritz with water, air dry, pat dry. There's a product called water
Water
wipes.
wipes.
Water wipes is nice. It's really water with like a little bit of glycerin, disposable wipes that will also get you cleaner, quite frankly, than any toilet paper will.
So I am not a fan of wipes. That is the only wipe that I tell patients that they can use, because
Yeah, because
all of the
otherwise you don't know
wipes,
what's in them.
when you read the back, you're going to have a whole bunch of chemicals you can't pronounce, and if that's on there, you shouldn't use it. And the other thing is, patients have this misconception. When something's wrong with their vulva, they think I'm not cleaning it well enough, and that's not the case at all. It's
No, and then
there,
they rub harder
and
and
they
more.
overclean, and overcleaning can cause issues too, with disrupting the flora or causing erosions, things like
Right.
that.
So
So,
soap,
yeah,
wipes. What about this myth? We talked about myths earlier, the bathing suit myth and the
right,
yogurt myth and how about this like sitting in tight jeans myth? Is that gonna, it might be uncomfortable, but it's not gonna cause problems.
right, right.
So, all right, we're gonna close this up unless anyone else has burning questions here, but I do wanna mention, there have been a couple of questions that come in about vulvar clinics. So our website is sexmedmenopause.nm.org. If you go on that website, you will find a tab that's vulvar and vaginal health, and that is the program for all of these things where we treat not only vulvar and vaginal itching, we treat all kinds of conditions. There's at least 50 or 60 of them. People haven't even heard most of them, hidradenitis and vestibulodynia, and the list is very long of conditions that we treat. So please go to the website, take a look. For those of you who came in late and want to take a look at this video, it will be on my Facebook page, it will be on my YouTube page, and it will also be on sexmedmenopause.nm.org in the video section, where we are putting a lot of these videos. So Mona Heckman, hi Mona Heckman. Berman, I forget that, I don't know Mona since she wants to know, is it okay to put cortisone on the vulva?
Yeah, so cortisone is what's available over the counter, which is your hydrocortisone usually. And typically, I don't recommend using creams on the vulva. They have alcohol in them, and they can sting, and ointments are better absorbed. So typically, I would prefer an ointment, which is usually prescription.
Yeah, and Inez wants to know about vaginal steaming. You know the answer to this, Inez. Steam your clothes, steam your carpets. Do not steam your vulva.
Or vagina. Leave the
Or
vagina
your
alone.
vagina. Oh my God! Don't get me started on Gwyneth. There, we could be at this for hours. So we're not gonna go there.
No.
But anyway, thank all of you for coming in. This is where. Send me your suggestions of other things that you would like us to talk about, other Facebook Lives. We do a lot of these. We've got a lot more coming up. So thank you for joining. Thank you for your questions. And if you want to stick around for a minute, then you will hear the theme song, the Francie theme song, which is from my books, which I did not talk about tonight, but my book, Slip Sliding Away, Turning Back the Clock on Your
Great.
Vagina.
It's fantastic.
I think it's a must read, and that came out last month. Next month is Hot Flash Hell, a gynecologist's guide to turning down the heat. After that is my book on finding your mojo, specifically orgasm after menopause. So keep them coming. We have a lot of fun things coming out. And this song that you're about to hear is the Francie theme song. Francie is my character that is throughout all of my books. She represents all menopause women everywhere. And yes, this song was composed and performed by my husband, who is a producer, singer, songwriter. You didn't know that. And the famous Megan McDonough. So enjoy and thank you all.
I finally found a friend who understands the flashes and the feeling dry as sand. My body was on pause, it wasn't taking calls. Then Francie took me by the hand. She told me all these things that I can do, and why it is that sometimes I feel blue. She helped me see the light